joining us today in Conversations is an extremely accomplished and prominent infectious disease expert. She is also acknowledged and recognized as a leading voice on public health issues in the national and international arenas. Ladies and gentlemen, and everyone tuned in, please join me in welcoming Professor Dato Dr. Adeeba Kamarulzaman.
Thank you for having me.
So the two themes that come about, we notice, are inequality, and the second, of course, is empowerment of women, specifically more balanced participation for women in society's fabric and system. Would you be so kind as to elaborate on these two important subjects and how they have become sort of themes to the advocacy work that you do?
Malaysia's done a lot, but there are many, many things that we could still do to see women advance further. Although in terms of basic education, I would say maybe 90% or more women have participated, but getting to the next level, with the exception of those people I mentioned before, it's still difficult because precisely of this, that support for the to bring up a family is just not there. We're relying on maids, we're relying on a childcare system that is not as comprehensive and as supportive as it should be. So if there's one area I think we in Malaysia can improve on, would be that, to see more women participation. Much can be put to the inequalities, particularly in the US, the lack of, and now Malaysia, we're seeing it, the lack of information, the lack of access to healthcare, the inability to discern misinformation and disinformation around vaccination, for instance, because of lack of education and lack of, health literacy. All these things are now playing up in Malaysia.
Much is spoken and celebrated about the rise of private healthcare in Malaysia. The pandemic, though, brought the spotlight right back to the public healthcare system and emphasized the importance of a well-funded, well-equipped, well-functioning public healthcare system. Could you share your thoughts on the dynamics between the public and private healthcare systems for a country like Malaysia? And is there such a thing as a sensible coexistence formula that caters to the needs of all the different constituencies in the country? Your thoughts, please, Prof.
We introduced the private healthcare system, which led to several things. One is, of course, the internal brain drain of senior doctors into the private healthcare. Two, a lot of out-of-pocket expenses for people. And three, underinvestment in the public healthcare system. For a country at our development level, we should be spending upwards of 7% of the GDP on health. I know it's our second biggest budget allocation after education, health is, but in the scheme of things, it's still only, if I'm not mistaken, 4% of the GDP, whereas it should be 7 or 8 for the things that we want to do. So if there's one thing that we should learn from this COVID-19 is we need to invest more in health, but invest more wisely.
Thank you so much for sharing with us so frankly on so many different topics. So
my pleasure.
It's really, Professor, is on behalf of all the audience that participated today. Thank you. And on behalf of MIDF, thank you. Terima kasih. And we look forward to catching up again, Professor. Thank you so much.
Thank you, Dato Dr. Bye-bye.
Thank you. Bye.